So coping is a very complicated construct. It involves various different emotion regulation strategies, problem solving, behavioral strategies as well. So it's not just one thing. And so I think at the moment, in terms of research with children and young people at least, we are still quite far away from looking to see whether or not it impacts behavior in an adaptive way. So, for example, reducing anxiety and depression. And so we are still a few steps away from establishing what the mechanisms of the brain are in terms of responding to these coping programs. If one were to hypothesize, one might think that certain circuits in the brain, for example, prefrontal regulation of subcortical or emotion areas of the brain may be implicated. But as I said before, we are still quite far away from reaching this conclusion. So we know that loneliness has an impact on brain health. We know that it also has an impact on mental health and on physical health. And we think that that mechanism is through stress and inflammation. And so perhaps if we have social connections with other people, the idea here is that it would have a protective effect, again, through the kind of stress and inflammation systems.